will you diagnose as an abnormal hair fall?
So we cannot change our genetics, so we can treat the hormonal changes.
What are the various diet factors that are more important when it comes to hair?
Only biotin deficiency and you are taking biotin chemies will not fix your hair fall.
So 2 to 3 times hair wash in a week is ideal for hair growth or to prevent hair fall.
So oil is required for the hairs, not for the scalp.
Like an ideal hair care routine.
So this will attract the growth of the fungus. So that is nothing but the dandruff.
Minimum 4 to 5 months is required for any treatment to be effective. Jai Shri Gurudev. Namaste and welcome to BGSMCH Aarogya Vani. Your health, our priority. I am your host Dr. Anu, Associate Professor, Department of Community Medicine. In today's episode of Aarogya Vani, we are dealing with a very important topic, a condition that affects millions of people in India and across the globe, hair fall. The causes can be many. It can be genetic, hormonal, it can be nutritional deficiency, or sometimes unknown causes. And the options that are available in the market are also plenty. A lot of hair oils are there, hair shampoo treatments are available, salon treatments are available, and hair transplant also you would have heard about. But what is the right choice for you? To help you make that informed choice, we have brought today in episode of Aarogya Vani our expert from BGS Medical College Hospital, Dr. Anusha, Assistant Professor, Department of Dermatology. Hello Dr. Anusha, a very warm welcome to BGSMCH Aarogya Vani.
Jai Shri Gurudev.
Jai Shri Gurudev. Everyone has hair fall. Now to start with, let us try to differentiate what is a normal hair fall and when will you diagnose as an abnormal hair fall?
To differentiate between a normal and an abnormal hair fall, we should know about the normal hair cycle. Okay. So it has 3 stages basically. The first stage is the growing stage, second is the resting stage, and third one is the shedding phase. Whenever the hair enters out of the scalp, it grows for a certain duration of time and it enters a resting phase. The normal growing stage for a human being is 2 to 7 years. The hair grows up till 2 to 7 years. After that, it enters a resting phase. So the resting phase is also standard for human beings, that is 3 months. After the 3 months, the hair will be shed off eventually and a new hair grows in the very same place and the cycle repeats for a lifetime. So the hair fall is normal. So in a normal human scalp, around 80 to 90% of the hairs will be in a growing stage. So the remaining 8 to 9% will be in a resting phase. So this 8 to 9% will be shed eventually from the human scalp. So the hair fall is normal. So what is the abnormal hair fall is up to 100 hair strands falling per day is considered normal. Anything which is crossing 100, beyond 100, 120, 150 is a dangerous sign. You should consult your dermatologist for the better treatment.
So anything more than falling off more than 100 hair strands a day is considered abnormal. Yes. And I think any person can easily identify that by seeing a lot of hair in your hair comb, or might be lot of hair fallen on the floor, yes. Or might be on the pillow.
Yes.
So repeatedly if it is happening, that means the hair fall is abnormal.
Yes.
Okay. What are the most common causes that you come across when it comes to hair fall?
So we see a lot of hair related problems in your daily OPDs. So there are 3 most common causes of hair fall in Indian population. So these 3 are telogen effluvium, the androgenetic alopecia and the alopecia areata. So the first one, the telogen effluvium, is mainly because of the nutritional deficiency. So this nutritional deficiency could be due to thousands of causes. The main causes for these nutritional deficiencies are the poor diet, any stress, or due to vitamin D3 deficiencies or low hemoglobin levels, or due to any viral infections or due to any chronic diseases. Okay, the patients will come with the complaints of severe hair fall for about 15 days, 1 month, 2 months, years together. They will have the hair fall continuously. When I ask them, so whether you are on any treatment, any illnesses that you are affected in the last 2 to 3 months, they'll disclose that I have been treated for a dengue fever or a typhoid or a malaria, like that. So as we discussed about the hair cycle previously, so in these stressful events in the body, the growing stage of the hair enters a resting phase whenever the body is in insult. Okay, so whenever the hair enters the resting phase, so it will be eventually shed after 3 months. So exactly 3 months back he would have been treated for some other illnesses. Now he is complaining of hair fall. So it is better to find out the root cause for the hair fall to treat them better.
So one of the most common type of hair fall, you said, tenogen effluvium. It's caused due to either nutritional deficiency or any prior history of disease. If there is a illness that a person had before, that lead on to hair fall. What about the other two types of hair fall?
So the other most common cause is this androgenetic alopecia, which is seen in males. Its female counterpart is female pattern hair loss. So in this condition, the male patients will come to us by seeing the hair thinning or pattern baldness in the scalp. Whereas in females, the clinical picture differs. They'll complain of hair thinning, ponytail thinning, and they'll be widening of the central partition. So the main causative factors here are two. Those are genetics, and other thing is the hormonal imbalance. So we cannot change our genetics, so we can treat the hormonal changes. So that is the mainstay for the treatment of androgenetic alopecia. So the third one is alopecia areata, in which the patient comes with patchy hair loss. So it is overnight patchy hair loss. There will be a severe hair loss. When they pull the hair, the hairs will come out, and when you inspect the scalp, there will be patches of hair loss that can involve your scalp, or in the males it can involve the beard area, the mustache area, and in severe cases it can involve your whole body hairs also. So the main cause for this alopecia areata is autoimmunity. So these three, the telogen effluvium, the androgenetic alopecia, and the alopecia areata are reversible alopecias. So if we treat better, if we find out the root cause and we treat them better, they are reversible hair falls.
Okay, so the causes of hair fall, the most common types is reversible.
Yes.
Right?
Yes.
Whatever be the cause, either it be nutritional deficiency or hormonal imbalance, it is reversible.
Yes.
So it's always better to take the opinion of a dermatologist and then find out the cause and go for a treatment.
Yes, find the root cause.
And one of the most common cause that you have mentioned is nutritional deficiency.
Yes.
Let us try to understand it better. What are the various diet factors that are more important when it comes to hair?
So basically our hair is nothing but a keratin, which is a protein. So your diet should contain proteins. Okay, so our body requires 1 gram per kg of proteins. So in that, for example, the protein rich foods are the sprouts, the pulses, the dal, the legumes, the lentils, and if you are a non-vegetarian, include egg whites in your diet. And other thing is the micronutrients. Those are vitamins, most importantly the biotin and the calcium pentatonate. These two are basically the vitamin B complexes. Examples for these biotin rich foods are carrots, bananas, and then egg, sunflower seeds, legumes, and there's spinach, mushrooms, etc. You can include all this in your daily diet.
Okay, so protein rich food and vitamin rich food.
Yes,
that is ideal for hair growth. Okay. What is the role of these supplements? And there is a lot of hype in the market for biotin gummies as well. What is your take on that? Is it good for hair?
So only biotin deficiency and you are taking biotin gummies will not fix your hair fall, because we should find out the root cause for the hair fall, then only we can treat them better. So you are taking biotin gummies on your own, you are treating yourself with the own treatment, and you will not experience any improvement. So moreover, the biotin gummies will have added preservatives, added sugars, and you are bombarding your body with unnecessary things. So you better to consult a dermatologist, they will know the required dosage of biotin and all other vitamins and all other micronutrients that are required for the better hair growth. So better consult a dermatologist before taking these supplements.
Okay, so prevent hair fall through a nutrient-rich diet.
Yes.
And regarding supplements and its role, leave to your dermatologist. If it is prescribed, you can take it.
Yes.
Right?
Okay.
Okay. Now let us try to burst some myths, because hair fall is a topic which has lot of beliefs in the community.
Yes.
Okay. One of it is that repeated hair washing, that too on a daily basis, can cause hair fall. Is it true?
So basically the function of any shampoo is to cleanse your scalp. Okay, any dirt or any dust or any excess sebum, that is the oil secretion from the scalp. Okay, it will cleanse that whatever the extra dirt is there. So and the shampoos are chemicals. So when you are washing daily with the shampoo, you are applying daily shampoo, so it will wash out all the good things also from your scalp. So that will lead to dryness of the scalp, and this will increase the brittleness of the hairs. It will weaken the hair strands. The hair strand will break easily. So better to avoid applying shampoo daily. Okay, so 2 to 3 times weekly per week hair wash is advisable.
So 2 to 3 times hair wash in a week is ideal for hair growth or to prevent hair fall.
Yes.
Right. So what about the oil massages of the hair? Is it good for hair?
So basically our body is well designed. It can take care of its own. So every hair strands has its own attached oil glands. We call them as sebaceous glands. So every day it is secreting oils to maintain the moisture of the hair strands. So whenever you are applying excess oil to your scalp, so there will be increase in the moistureness of the scalp. So this will attract the growth of the fungus. So that is nothing but the dandruff. So you'll end up getting dandruff also. And if you are applying excess oil to the scalp, it will lead to clogging of the pores in the face, leading to face acne. Whenever you are applying to the hair strands, it can lead to body acne also. So avoid excess oiling. So oil is required for the hairs, not for the scalp, because for the hairs it will the sebum will not cover till the tip of the hairs. So better to apply the oil for the hairs and leave it for 30 to 1 minutes before washing your hair. That is ideal, and avoid oiling your scalp.
So in the market also there are a lot of shampoos that are available. Some claim that they are sulfate free. Some claim that they are parabens free. People might not understand all these terms. Do you have any suggestions on that, like better options when it comes to shampoo selection?
So these shampoos and soaps are nothing but acid-base combinations. So these are chemicals. This will affect your pH of the scalp as well as your hairs. So now there are multiple cleansers like sulfate-free. Surfactants are there. Surfactant, the main function is that it will cleanse the dirt, excess dirt, not affecting your pH of the scalp or the hairs. So better to use this sulfate free surfactant. Those are labeled as cleansers. Okay, so better avoid those traditional shampoos and shift to the cleansers. It will not have many chemicals and it will not alter the pH of your scalp.
So rather than using shampoos, hair cleansers are a better option.
Better options.
Right.
Yes.
What is the impact of hair coloring and all these fancy hair treatments on the hair?
So these hair dyes are nothing but the chemicals. Okay, whenever you are applying the chemicals, it will take away all the moisture from your hair strands and will lead to the weakness of the hair shafts. It will eventually breaks from the scalp. So other treatments you asked about me is a keratin treatment.
Yes.
Botox and all. Okay, basically in this they'll apply the protein rich creams and they'll do the straightening with the high degree of temperature. So if you are applying such a high degree of temperature to your hair strands, obviously it is going to weaken your hair strands. It will weaken the hair shafts, and the hair shafts eventually will be break down from the scalp. So better avoid all other cosmetic treatments to your scalp.
When a patient approaches you with hair fall, what are the common investigations that you do?
So basically, when the patient come to me with the complaints of hair fall or any hair related problems, we have to take a proper history to find out the root cause for the hair fall. So after taking the detailed history, we'll examine the we'll do the trichoscopic examination, which will guide us in diagnosing the condition. Okay, so basically it is nothing but a non-invasive, very simple bedside test which can be done in OPDs. So when we keep the trichoscope, we'll get to know the changes, the minute changes in the scalp we'll get to know, and we can diagnose better and we can treat them better. So apart from this trichoscopic examination, we have other blood investigations to know the nutrition levels in the blood, like example the hemoglobin levels, the vitamin D3 levels. These two are the most common causes of hair loss in Indian population, especially in female patients. So better to find out that deficiencies to treat them better. So other investigations like the thyroid profile is important, and other hormone assays also important.
So whenever a patient comes to you, you try to find out the cause.
Yes.
Right? Either it be through the history, trichoscopic examination, or blood investigations.
Yes.
And once a diagnosis is made, what are the various treatment options that are available?
So as we know, the causes of a hair fall is different. It should be multidisciplinary, because the hair fall is happening only not because of one thing. It could be due to action of multiple things like the nutrition deficiency, hormonal changes, and hypersensitivity to the hormones, like that. The treatment differs for telogen effluvium. The treatment differs for androgenetic alopecia. In androgenetic alopecia, we have stages of hair fall. In males, we have 1 to 7 stages of hair fall, and in females 1 to 3 stages of hair fall. Every stage the treatment differs. So you better to consult your dermatologist to get better treatment. So in case of androgenetic alopecia, in the earlier stages of the disease, the medical treatment helps better to give the better results, and in later stages of the disease, the oral medical treatment along with some procedures will help. So in later stages, that is the 7th stage, 6th stage of the disease, better go for hair transplantation, because there will be complete baldness in 7th stage of androgenetic alopecia. So here one more interesting thing is, for any hair treatment to work, it will take at least 3 to 4 months of continuous treatment, not interrupted. You have to take a daily treatment. You have to invest your time on your hair care and hair treatments. So the patients come to me. When I treat them, they'll come by 2 weeks, by 1 month. I have used these products as you advised. There is no improvement at all, like that. So we have seen treatment after 5 to 6 months of treatment. So you should be patient with your hair treatment. So it will take at least 3 to 4 months of regimen.
So this is the reason why so many products are there available in the market as well. People tend to change the doctors,
Yes.
Change the hair treatment plans, because they are not finding the immediate results.
Yes.
So the take home is that minimum 4 to 5 months is required for any treatment to be effective.
Yes.
Right. So along with the medical treatments, you mentioned about the procedures.
Yes.
What are the various procedures that are available for hair fall treatment?
So we are doing platelet-rich plasma and the growth factor concentrate. So it is basically we are taking your patient's own blood and centrifuging it and injecting those platelet-rich plasma, which has higher concentration of only growth factors which are required for the hair growth. Okay, so we'll inject directly into the scalp. So it will stimulate the hair follicle for the hair growth. So this PRP is different from GFC. It is a modified version of PRP. So it is called as growth factor concentrate, which will have higher concentration of growth factor compared to platelet-rich plasma. So these two along with the medical treatment will give better results. So even this also, the patient should take 5 to 6 sittings of PRP or GFC to see visible results.
As mentioned, PRP and growth factors are effective as an adjuvant therapy along with
Yes.
medical treatment.
Yes.
And for advanced stages, you mentioned about hair transplant.
Yes.
Right. Okay. So now we covered almost all the relevant queries and doubts that our listeners might be having. What are the causes? What all tests they have to undergo to
Yes.
find what are the reasons for their hair growth, or even the various treatment options that are available. Now, what is your key take-home message for our listeners? like an ideal hair care routine?
So, in a week, as I mentioned earlier, 2 to 3 times a week hair wash is advisable, and always dilute your shampoo, or if you are using cleanser also, dilute that and apply to your scalp. So apply a good conditioner to your hair strands, and as we know, the most common cause for hair fall is nutrition deficiencies. So maintain a good diet, and to avoid stressful events, good sleep, and to tackle the hormonal changes, the physical activity. So avoid these salon treatments which use excess of heat and chemicals. Avoid combing your wet hairs or rubbing your wet hairs. And whenever you are traveling in a polluted area, whenever there is gush of hair is coming and which is taking away the moisture from the hair strands, better to cover your hair strands. And when you are using fan at night, cover your hair. It will maintain the moisture of the hair strands. And avoid taking home remedies and self treatment, because if you take supplements for too long, it may lead to hypervitaminosis, and that can lead to hair fall again. So for any queries, we are here, so you can consult a dermatologist for better solutions.
Thank you, Dr. Anusha. Thank you for spending your time out of your very busy OPD schedule and help us giving valuable insight to the community. Thank you. Thanks a lot.
Thank you.
We hope that this discussion was informative and has helped you clear most of your doubts. Remember, a nutrient-rich diet, a good sleep, stress-free life, and seeking expert guidance at the right time can actually make a difference. If you like this video, please do like, share, and subscribe to our BGS Medical College Hospital YouTube channel. If you want us to cover any health-related topic, please put down in the comments below. With that, we conclude this episode of BGSMCH Aarogya Vani. Stay informed, stay healthy, and take good care. This is your host, Dr. Anu, signing off.
If you enjoyed this video, don't forget to give it a thumbs up, share it with your friends, and hit that subscribe button for more exciting content.